रहते हैं ना, अगर कोई डॉक्टर दिखा तो वहां पे डर के भाग जाती है, वो क्या पूछ देगा, ही मे आस्क समथिंग, कुछ पूछेगा तो क्या जवाब दूं। unless unless you are updated with your knowledge, you will be afraid in the hospital, you will be running away from the patient, you will be running away from the medical professionals, and family का बर्बाद हो ही जाएगा, ऐसा है. So always update knowledge. This is my personal request for every.
As we know, we all have gathered here for a session, for a very educational and intellectual session, and our today's topic is understanding influenza virus and everything that a normal person should know about the virus and the health. So we'll be waiting a few minutes so that other people could join us, and then we'll continue. Let me just add the topic over here. Good evening to one and all. Okay, so to begin with, today's topic is understanding influenza virus. So to start with some bullet points or the introduction of what we will be having in our upcoming session is that we will be going to understand what are the types of viruses, how does virus affects human beings, how and what is influenza virus, its signs and symptoms, its clinical presentations, or in layman terms, we will understand all the effects of influenza virus on human beings. Also, we are going to see that how the new viruses are emerging nowadays and how they're affecting our world or other places, including India. And today we have our guest, that is Dr. S.P. Nayak sir. To introduce about him, I would like to say that he is a graduated PharmD. He has completed his MSc and has qualified his QCHP exam. He is also completed his MSc in dietetics. So we are very honored to have him on board. Now I'm just sending the Good evening, sir.
Yeah, good evening, Hema. Am I visible to you?
Yes, sir, we're very happy and glad to have you over here. Am I audible, sir?
Yes, you will. And how
Yes, sir, you are
my
visible.
voice? Yes, it's okay.
Yes, sir.
Okay, go ahead.
Yes, sir. May you just introduce yourself once to the audience over here?
First of all, thank you, Hema, for inviting me for such interactive sessions. I'm very glad to share my views regarding influenza and related concepts, which is very important in present scenario.
Yes.
Apart from the normal people, getting knowledge related to influenza is very important for as well as our medical professionals. So let's hope this session would be useful for everybody.
Yes, sir. I've already overviewed about the topics we are going to cover in this session. And I also want to add that all the people who are in audience can write their any doubts or any questions they want to ask to sir in the comments here. And I'll be asking those questions at the end of the session. So hope you all are listening and let's get interactive. So to begin with, sir, my first question is that like before starting our main topic, let us start with the basics, like what are the viruses and how are they affecting all the human beings?
Okay, so your first question is what is virus and how virus infects humans, right? So
Yes, sir.
Before understanding about the influenza and other viral infections, first of all, let us understand what virus is. Virus is not an organism. We should try to understand this. Virus is not an organism, but it is just a particle. It is a pathogenic particle. Same like bacteria. We have so many other microorganisms like bacteria, fungi, parasites. We have so many other microorganisms. So likewise, virus is also the organism, but it is not the living part. When virus infects the living organism, in the living organism, the viral particle tries to get activated and it develops its offsprings. So virus is the microorganism, microparticle, which can infect bacteria, it can infect all animals like humans, it can infect humans, and it can also infect some plants as well. So virus is a particle which can infect any other microorganism. When they infect the microorganism, they try to develop their offsprings by sharing their genetic material with the host cell. So in virus, if we understand the different strains of virus, different types of viruses, we have so many types of viruses, starting from influenza virus. We have influenza A, influenza B, influenza C, D, and we have severe acute coronary related viruses, SARS bolte. And we have so many other virulent viruses, like we have HIV virus, we have Ebola virus. So depend on the structure and depend on their virulence, virus particles are classified into various types, and depend on the disease what they infect, they are differentiated or they are classified into various types. So first thing, virus is not a microorganism, it is just a particle. It can infect the living organism and it will develop its offspring by uh, depending on the host. So virus, when it is outside the living organism, it is just a particle. When it infects or when it ingests into the living organism, it will be very virulent. By sharing its RNA or DNA, actually all virus particles predominantly they will contain RNA. A few retroviruses, especially like HIV virus, it has only RNA particle, and a few viruses also has DNA particles. So DNA and RNA both are nucleic acids which are very important for developing their offsprings. So this is some basic point about virus.
Yes, sir. Thank you, sir. This is a very important point. Not a microorganism; it is just a particle, so that the audience remembers it. And now to move forward to the next question, is there any difference between influenza virus and the other viruses in terms of how it affects the human beings?
Yeah, as I was telling you that yes, influenza is different from other virus particles based on their protein structure which is available on its cell on its surface. Depend on that and depend on their virulent activity. Depend on their disease. There are so many types. Influenza is particular virus which will cause respiratory related disorders particularly. So simply we call influenza virus as flu. So we have common cold. Common cold is commonly caused by rhinovirus. It is influenza virus. And we have swine flu virus. Swine is nothing but it is originated from pigs. So swine flu virus is the virus which is initially it was infected from the pigs. That's why we call it as swine flu. And in swine flu we have H1N1, we have H2N2, we have so many types of influenza viruses. So actually this H1N1, this name H1N1 is given based on its proteins which is present on its cell surface. Actually, everybody should remember in influenza virus, especially in influenza A, the viral particle contains two types of proteins. The first type of protein which is called hemagglutinin. H means hemagglutinin. First protein is hemagglutinin, and the second protein is N protein. H protein and N protein. So in H proteins, we have 18 types of H proteins. And in N proteins, we have 11 different types of N proteins. So if any viral particle has first H as 1, and in N protein, if it is having N as 1 or N as 2, then the name of the virus is simply H1 or H1N1 or H2N2 like that. So just understand the H proteins, we have 18 different types. And in N we have 11 types. If any of these protein is present in that virus, they are named like that. So if H is first protein, I mean H1 is one protein, and the same virus has N as N1 protein, then the name of the virus is H1N1. And if a virus has H1 protein on its cell surface and N protein as N11 on its cell surface, then the name of the virus will be H1N11 like that. So on the influenza A virus, on its surface, we have hemagglutinin, H proteins and N proteins. Based on these two different types of proteins, the names of viruses is given according to their types of protein.
Yes, sir. So as you have said that there are many types of viruses and each has subtypes and subvariants. So we are surrounded by viruses. So how do we prevent ourselves from getting infected?
Yes, this is very important question. I will try to explain this in my layman language so that all non-medical professionals, non-medical people also can understand how can we protect ourselves from getting infected from virus or influenza particularly. So first important thing for influenza viruses, for influenza viral diseases, for influenza virus, we have vaccines. Influenza vaccines bolte.
Hmm.
So everybody annually, those who are at risk or those who are staying in high influenza prevalent places, that particular patients should be vaccinated. Number one. First prevention, first precaution, what we have to take is we have to get vaccinated. Wherever influenza vaccines are available, for every strain we have different types of vaccines, and we have certain vaccines which can be effective for most of the viruses. So first, what we have to do is we have to take vaccination. Number two, as influenza viruses, they are mainly infected through nasal route and through oral route. If anybody are having signs and symptoms like flu, if anybody is having flu-like symptoms like sneezing, coughing, sore throat, severe body pains, fever, so in that cases, that particular patient isolated in their houses itself. So this is very important precaution we have to take. अगर कोई infected है, कोई infect हो गया है, maybe वो influenza हो सकता है, कुछ भी virus हो सकता है. So in that cases, what the infected patient should do, they should get isolated and they should not try to go to the crowded areas so that it will prevent others to be infected. Number two. And number three, as we all know, hygiene, maintaining hygiene is very important. Always keep washing the hands, maintain hygiene, wash the clothes properly. ये सब तो common ही है. And when you go to the crowded areas, always wear a mask. When you are going to talk to the influenza patients or pneumonia patients, or when you are visiting the hospitals, if patient is suspected or if patient is vulnerable, for example, the older populations are having high vulnerability. Older populations को infection होने के chances बहुत ज़्यादा है. If anybody is suffering with pneumonia or if anybody is suffering with other bacterial infections or other infections, so उनमें influenza virus फैलने के chances बहुत ज़्यादा है. So always they should wear a mask and better not to go to the crowded areas wherever infection is possible. So this is third precaution we have to take. And fourth precaution is always maintain good immunity in the body. Good immunity कैसा होगा? Always maintain balanced diet, never skip meals, doing regular exercises and taking plenty of water. And very important one, taking good sleep. These all parameters what they can do, they will improve the patient's immunity. Immunity में क्या क्या बताया था? Taking balanced diet, taking a lot of water, taking enough rest, and taking good sleep and doing exercises. These will boost up the immunity, and when patient is highly immunized, I mean, जो immunity अच्छा है, so they can fight with all related bacteria as well as virus particles. So this is the fourth prevention. So these are important preventions. I think I cleared the question.
Yes, sir, that was such an elaborative answer. Now I hope that audience got the answer that how they can prevent themselves from the viruses around. So to begin with next question, I just want to remind all the audiences that they can put their questions in the comment section so that I can ask those questions to sir at the end of the session. So yes, sir, the next question is that as we just got past with COVID and nowadays we are hearing new viruses now and then. So why are such viruses emerging? Is there any reason behind this re-emergence of viruses?
Yes, even this is also a very typical question and interesting question. Firstly, I would like to differentiate the influenza virus and coronavirus. Both the virus particles are totally different. As I was telling you, influenza virus, it is categorized into the influenza virus category. And COVID-19, what we say, coronavirus bolte. So this COVID virus comes under SARS, severe acute respiratory syndrome virus bolte isko. So these two categories are totally different. So SARS virus was already abhi thode countries mein its prevalent is already there. And as you told, influenza virus is emerging nowadays. Influenza virus mein abhi H3N2 dikh raha hai. So this H3N2 virus and COVID virus, COVID disease, coronavirus, why this type of viruses are emerging in this present scenario? ऐसा नहीं है कि ये वायरस आज ही आया है. This type of pandemics were there since long back. आज ही नहीं है, कोरोना वायरस आज का नहीं है और इन्फ्लुएंजा वायरस आज का नहीं है. This virus emerging was since long back. 1968 में फर्स्ट टाइम इन्फ्लुएंजा एक पैंडेमिक आया था हांगकांग में. Thousands of people died in 1 year itself in Hong Kong. तो वहां से इट स्टार्टेड माइग्रेटिंग टू अदर कंट्रीज, दूसरे दूसरे देशों में गया और वहां पे इट वाज ए वेरी डेंजरस कंडीशन. सो 1968 में ही नहीं, उससे पहले सार्स वायरसेस थे, उसके पहले कोविड क्या बोलते हैं एबोला वायरस थे, उसके पहले बहुत सारे डिफरेंट टाइप्स ऑफ वायरसेस वर देयर. सो दिस वायरस इज not emerged in present scenario, it was there from the past and it will be in future as well. You have to remember this. We should be ready to fight with such different types of strains and such different types of viruses in future as well. So ये क्यों mutate होते रहता है is the question. I will try to answer this. See, when viral particle is outside the host or outside the living organism, it is situated or it is available as non-living being or non-living thing. When the environment becomes suitable for this virus, immediately it will go and infect the organism. If the organism is susceptible or if the organism is immunosuppressive, if the organism is unable to fight with that virus, then what happens? That viral will immediately it starts its offspring. It will develop its offsprings and it will try to infect other people also. So when time passes, viral particles will try to see the favorable environment. किसी भी एक year में favorable environment आ गया, and in that year, if the human beings or the other living organisms are susceptible for that virus, in that time pandemic आना ही है, आ जाएगा. Okay. So every year, in every environmental conditions, every weather conditions, the viral particle, देखो, every season to season, the viral particle is having one ability to get mutation in its structure. हर एक environmental condition में mutation होते रहेगा. It will be mutating itself and new variant will be occurring because it has that ability. It is not even an organism. ये virus का ही नहीं. It is formation of new variant is not only seen in the virus, even in human beings, even in other living organisms. When we travel to the other environmental conditions, our body will try to modify with that environmental condition. So virus also tries to modify its genetic material and it tries to modify, it tries to stay in that extreme environmental conditions. ये law of nature है. Law of nature itself tries to develop these variants. ये virus में ही नहीं, हर एक living organism में होगा. I think my point is clear to everybody.
Yes, that was very detailed answer. Now, talking more about the variants, we have recently come across H3N2 virus, influenza virus. So, can you share your some views on this virus?
Yes, as I was telling, ये influenza virus आज का नहीं है. It was since long back. So, whenever we find some people who are susceptible to certain viral particles or certain bacteria, तो वहां पे आ सकता है. अभी अभी अपने को न्यूज आया है 2-3 दिन पहले कि इंडिया में some people got infected with H3N2 and people are dying out of this disease. And influenza में देखो, influenza में any virus particle may be infected to any patient. ये किसी भी पेशेंट में हो सकता है. And one more point we have to think, we have to know everybody that अगर किसी भी पेशेंट में अगर ये influenza वायरस आया है तो इसका ट्रीटमेंट इलाज बराबर इलाज नहीं है. We don't have specific treatment for specific influenza virus. Why? I previously told you that influenza virus particle will try to develop its own variant, its own different variant. When it is having ability to develop different variants in time to time, it is very challenging for medical professionals to overcome or to treat such or to kill that virus particle. So in such conditions, we have to be very careful, and in future human life is going to be very challenging. ये सब चीजें अपन अभी we have to be ready.
Yes, as you said that there is no specific treatment for this influenza virus. So, what are the guidelines? Like, how should we try reducing the symptoms or treating the influenza virus in nowadays?
Yes, this question is important for all medical professionals. If anybody got infected with either SARS-CoV virus or with coronavirus or with influenza virus, how should we treat the patient? See, firstly, when patient gets infection with influenza virus, either it is H1N1 or it is H3N2 or it is any type of influenza virus, patient will have sore throat, cough, sneezing, running nose, body pain is very important, fever. Immediately patient will have fever. In some patients we have GI related disorders like diarrhea, constipation, and if patient has diarrhea, तो electrolyte imbalance होगा, dehydration होगा, and even that will cause many other complications. So if anybody has viral infection, especially influenza infection, we have to treat the patient based on signs and symptoms. अगर cough है, cough को suppress करो, electrolyte imbalance है तो rehydrate the patient, dehydrate हो गया तो rehydrate करो, electrolyte imbalance हो गया तो electrolytes replenish करो. replenish the electrolytes. If patient has fever, reduce the fever. If patient has any other complication, we have to treat the complication. So for viral infections, remember, only we have symptomatic treatment. And see, if anybody has influenza virus, initially it was just flu-like symptom. Slowly what it does, the influenza virus will enter into the lungs and it will cause consolidation. It may lead to pneumonia. For secondary, it may also cause bacterial pneumonia. And along with that, it may cause bronchitis, it may cause asthma, it may also cause COPD. So there are so many complications. And in that complicatory lung-related disorders, we have to treat according to the guidelines, like we have corticosteroids, because in that case corticosteroids are drug of choice. Severe lung inflammation ho gaya to corticosteroids will be the drug of choice. So as based on the signs and symptoms, we have to treat the patient. Or बहुत सारे guidelines है. Each viral particle, each disease, each symptom, each condition, we have different guidelines. So based on the condition only we will treat the patient. ऐसा नहीं
so mostly symptomatic.
हाँ, एक specific condition में एक specific drug ही देना है करके कहीं नहीं है.
Okay. Yes, so that answers my question. And as we are from family background and majority of our audience are also from family. So what do you think how like the intervention of a clinical pharmacologist can modify the therapy of a patient in such epidemics or such viral infections?
Yes, this is a little bit challenging for me being a clinical family graduate. See, in hospitals, as I told, there are no specific guidelines for specific viral infections. First, to survive in the medical field, all PharmD graduates, they should keep updated with their knowledge. तो कल देखो अभी H3N2 वायरस चल रहा है, तो we have to be ready. We have to keep referring all different guidelines. 2-3 दिन में guideline आ सकता है. So some in any of the countries, some guidelines will be published. So immediately we have to read those guidelines and be ready. Most of us PharmD students, what we do, we depend only on the old data. We depend only on the old textbooks. We never study the recent publications. So clinical pharmacist, PharmD graduates, what we have to do is we have to be ready. We have to keep updating our knowledge. Recent updates क्या आ रहा है? You have to follow all the guidelines, all the organizations, viral organizations जो भी है, pulmonary organizations है, cardiovascular organizations, heart organizations जो भी है. If you are interested in specific system, you should be updating your knowledge. Unless you update your knowledge, you are unfit for staying in the hospital, in the clinical sector. ये चीज याद रखना, number 1. And number 2, as we are clinical pharmacists, always develop your drug knowledge. Always keep revising the drug knowledge. Most of us think that एक बार पढ़ लिया, pharmacology पढ़ लिया, एक drug के adverse effect 2-3 पढ़ लिया, याद कर लिया बस. No. To survive in the medical field, every day we have to study clinical textbooks, clinical knowledge, update रहना. So if you can do these 2 things, you can easily survive in the hospital, and we will be in a position to answer each and everybody. Hospital में अगर कोई physician पूछेगा तो दे सकते हैं आंसर, patient पूछेगा तो आराम से काउंसिल कर सकते हैं. So unless we are updated with our knowledge, डरते रहना. अगर कोई डॉक्टर दिखा तो वहां पे डर के भाग जाते हैं, वो क्या पूछ देगा, he may ask something, कुछ पूछेगा तो क्या जवाब दूं. Unless you are updated with your knowledge, you will be afraid in the hospital, you will be running away from the patient, you will be running away from the medical professionals, and PharmD का बर्बाद हो ही जाएगा. ऐसा है. So always update knowledge. This is my personal request for every.
Yes, sir. Thank you, sir. And I would just like to remind the audience about that they could, of course, comment their questions so that we'll have an interactive session at the end of this interview. So, sir, going to the next question, as you said that we must be always updated with new knowledge. So, is there any other way that we could be prepared or be ready for such epidemics or pandemics?
Other ways in the sense, do you expect me to answer the resources for knowledge, or I didn't get you?
Yes, like we are getting to know about new viruses now and then. So how, yes, being a medical profession, should we be prepared about? Yeah.
Okay. Yes. As I told, firstly, we should be updated with the knowledge before counseling the patient. When you go to the pneumonia ward, or when we go to the TB ward, or when you go to the COVID ward, without getting preparation, it is very, very unfortunate to go to such wards. So be prepared and always maintain the knowledge, always be updated with the knowledge, have a good diet, and go to the hospital and try to counsel the patient and do your duty on time.
Yes, sir. Thank you. Got my answer.
Yes, I would like to add some points here. As you told, how to get updated with the knowledge and all. As of now, we are having a trendy artificial intelligence. I would like to suggest all PharmD graduates to use ChatGPT, which is a booming artificial intelligence nowadays in market. So if you want to get brief knowledge or anything related to medicine or anything, ChatGPT is wonderful. It is doing wonderful job in giving answers. So I recommend every medical professional to use ChatGPT for updating your knowledge. And along with this, we have every free website and free application that we have Medscape. So every mobile should have a Medscape. And our university also provides, every university, not our university, every college and every university provides their own softwares, like we have Micromedics, we have Clinirex, so many other softwares. So try to be familiar with those softwares and try to use those softwares so that you can develop. And along with this, if any clinical professional wants to update the recent knowledge, like recent knowledge and recent developments, we have one platform which is called www.mycme.com. Let me repeat, www.mycme.com. So in that, you can register yourself and start doing different courses. There are free courses available in that website. Firstly, you have to register as a pharmacist or as a physician, whatever field you are in. And there you will be having many courses. So recent courses actually they are. So through that also, you can develop your skills to survive in the medical field. So these are
Yes.
some courses.
Yes, sir. Thank you, sir. Hope that all students just note it down so that they make sure to log in and get registered. So, sir, getting back to viruses, is there any major difference between H1N1 and H3N2 virus that we must know?
Yes, the difference between H1N1 and H3N2 virus. As I was describing you about this influenza virus, H1N1 was first originated in 1960s from the pigs, and at that time the influenza virus, the virulence was quite different, and the people at that time were different. वो टाइम पे वो जमाने में जो human beings के अंदर जो immunity था, वहाँ पे they try to survive in those time. As I was telling you, this influenza virus particles will be mutating itself depending on the environmental condition, depending on the pollution, depending on the climatic change. देखो, 100 साल से पहले जमाना कैसा था and 100 साल के बाद अभी जमाना कैसा है. At that time there was no pollution. At that time people were having good immunity. ऐसा नहीं बोल सकते कि वो जमाने में लोग immune थे. नहीं. आज के जमाने में people are immune. Why? How? Because we are having extraordinary vaccines. We have vaccines for each and every disease. And we have medicines for each and every disease. So we are super immune nowadays. So we can survive. अगर वो जमाने में H1N1 virus जो था, अगर आज भी H1N1 आ गया ना, तो people can survive. People can survive with H1N1. That's why H1N1 is not available today. H1N1 is not doing anything today. That's why H1N1 got mutated into H3N2. Okay, to survive its variant, to survive its offspring, H1N1 got converted into H3N2. अकल पर the जमाने में देखो, I told there are different types of proteins which is available on this surface of the viral particle. उसमें कुछ भी mutation हो सकता है. So based on the mutation, based on the protein, any variant may be available. So that particular virus may be dangerous than the previous one or may be weaker than the previous one. We can't say. अब H2N3, sorry, H3N2 के data अभी we don't have proper data. Sufficient data is not available. We can't say कि it is more virulent to H1N1 or it is less virulent. We can't say unless I mean if few days goes we can't say anything. And ऐसा नहीं कि कोई भी एक बंदा आके ऐसा नहीं बोलेगा कि ये virulent ज़्यादा है, ये कम है, ऐसा नहीं बोल सकते. It is totally depend on the immune system which is present in the human beings. Totally depend on the human immune system.
Okay. Yes, sir. Got my answer. So, in the most layman language, how much scared should we be from the H3N2 virus?
How much?
How much
I didn't.
Scared. How much scared should we be?
How much fear? You are talking about fear.
Yeah. Yes.
See, as I am a psychologist, I won't say people to be scared of any disease because making or telling someone to be scared is another scenario which can again cause some other disease condition. Because scaring can lead to anxiety. Anxiety can lead to low immune system. Low immune system again can lead to depression. So depression again can lead to many consequences. So पुराने जमाने में डिसीजेस थे, आज भी है, कल भी होंगे. So डरने की बात नहीं है. I told to take precautions. Number one, get vaccinated. Whoever is ready to take vaccine. If any vulnerable population is there, like diabetic, hypertensive, or older populations, special care should be taken to those populations. Maintain hygiene, take plenty of water, take enough rest, do physical activity, exercises. This can prevent you from any kind of virus today and also in future.
Yes. Got my answer. So we have almost completed all our questions regarding the virus. So at the last, do you have any advice for all the medical professions or the general public regarding the virus or the increased incidence of the epidemics or anything?
Advice. Already I have
Yeah.
given the advices in my previous answers, but okay. For the common people, I would like to say that uh, take plenty of water, number one. And if you are having any comorbid conditions like kidney related disorder, or if you are having liver related disorder, or if anybody is having habit of taking smoking or alcohol, and if anybody is having hypertension or diabetes or any other chronic disorder like asthma, COPD, that particular populations are at greater risk of developing influenza virus. Very important point. So those patients should be taking immediate precautions. And for normal people who are not having any disease conditions, they can be happy. They can do all their activities, whatever they do. And I would like to advise not to go to the crowded areas without wearing a mask. If you go, you have to wear the mask. You have to follow the protocol. And as I told, the hygiene, maintaining hygiene is important. In that four important points I already told. First one is to maintain hygiene, like taking diet properly. Okay, diet में balanced diet. Balanced diet में high protein diet, normal carbohydrate diet, and fat जितना भी चाहिए उतना. Always in the diet you have to maintain 70% carbohydrates, 20% protein, and 10% fats, and remaining vitamins and minerals and water is common. This one every day everybody should follow. Taking a good protein like pulses and regular feeds and all is very important. It is very important for maintaining immune system. So this is for normal population. And for healthcare professionals, as I already told, I already advised to maintain their hygiene, maintain their protocol while going to the hospital, update their knowledge. And I already told the resources as well. So be updated, especially for the family graduates. Be updated. कभी भी update रहना. कोई कभी भी किसी भी question पूछेंगे तो you should be ready to give the answers. Okay. So by this I finished my advice.
Yes.
अगर कुछ advices है, अगर if you have any specific questions, I'll be very happy to give the answers.
Yes. We have some questions from our audience. The one question is there any concept like antidote for viruses?
एंटीडोट ऐसा नहीं बोल सकते. See, for virus we have drugs, antiviral drugs, and along with drugs we have vaccines. एंटीडोट ऐसा कुछ नहीं बोलते. एंटीडोट का मीनिंग ही है इट इज गिवन इन टॉक्सिसिटी. टॉक्सिक कंडीशन में जो भी उसको काउंटर करने के लिए जो देते हैं उसको एंटीडोट बोलते हैं. बट इट इज a viral infection. So in viral infections we have treatment strategies, we have management strategies, we have antivirals, and we have vaccines. So as previously I already told, we have so many types of influenza vaccines. So influenza vaccine, अभी जो influenza vaccine है present as the vaccine what we have, maybe it may be effective on H3N2 or it may not be effective on H3N2. We can't say. But for specific H3N2, we have to develop vaccine.
Yes. So we have another question, which is what is the period or time required for influenza to recover?
वैसा नहीं बोल सकते कि this is the specific time to recover from the virus. It depends from patient to patient. As I told, अगर vulnerable population है, it may take months, it may take years to be treated with the complication. But as influenza virus is concerned, influenza virus in 3 to 5 days it will develop the signs and symptoms, and in a week or two, influenza virus will be disappeared itself from the body.
Okay.
And I would like to add one more point here. If anybody is infected with the influenza virus, most of us think that taking antibiotic may be effective for viral infections. Always remember, if you are a clinical professional or if you are a normal individual, when you are confirmed with influenza virus disease confirm करने के लिए we have basic test, we have antigen antibody test, and we have very simple PCR test, polymerase chain reaction बोलते. This PCR test will easily identify the nucleic acid or the genetic material which is present in virus. Based on that, we can easily identify that patient is having viral infection. अगर किसी भी patient में viral infection है, तो never ever take unnecessary antibiotics. Number one. If patient's influenza virus, as I told, it will stay in the body for a week to from a week to two. It will stay in the body for a week or for 2 weeks. अगर 1 हफ्ते 2 हफ्ते से ज्यादा हो गया, if the virus treatment is अगर ट्रीटमेंट कम नहीं हुआ, if virus is not treated in 2 weeks, then after 2 weeks we can suggest antibiotic because the virus itself can cause secondary infection, secondary bacterial infection. 2 हफ्ते के बाद ही होगा वो, 1 हफ्ते में बैक्टीरियल इन्फेक्शन होने के चांसेस बहुत कम हो सकता है, वो भी हो सकता है। ऐसा नहीं है कि 1 हफ्ते में, सर बोल रहे थे 1 हफ्ते में एंटीबायोटिक नहीं देना चाहिए। अगर बैक्टीरियल इन्फेक्शन सस्पेक्टेड है, वो 2 दिन में भी हो सकता है, 1 हफ्ते में भी हो सकता है, 2 हफ्ते के बाद भी हो सकता है। अनलेस and until patient is having bacterial infection suspect, we should not give antibiotic.
Okay. Yes, I got it. And so we have another question, which is, can influenza become our next serious pandemic?
Yes, हो सकता है। Influenza can become serious pandemic, हो सकता है। Why not? In 1968, लाखों patient H1N1 killed, and in present scenario, it may also cause, it may also can. ऐसा नहीं है कि ये नहीं हो सकता है, हो सकता है। एंड वी कांट से नहीं भी हो सकता है, होने के चांसेस है। दैट्स इट।
यस सर। सो एंड who should take vaccines for it right now? Like what, how should we categorize that who should take?
Yes, this is very interesting question and important question. As I was telling you, especially the vulnerable populations, those who are having diabetes, those who are older populations, and those who are already infected with the viral infection in the past, or if the patient is immunosuppressive, or who are taking immunosuppression, or patient who are on corticosteroids, in these particular populations vaccine is very important. They should compulsory, they should take annual vaccines करके आती, influenza annual vaccines. Diabetic patients तो, diabetic older populations तो every year they should take influenza vaccine. It is mandatory, it is must. ये थोड़े countries में already है, अपने countries में भी है। Those who are willing, those who are aware, they can take these vaccines.
Yes sir. Thank you sir, we are done with questions now. If our audience has any other questions, they can of course DM to this page Drugsbugs, and we'll try to cover it in our next session. Yes sir, we are done with question and answer. Do you want to say anything?
Firstly, yes, Heba, I was very happy that you invited to give certain awareness on influenza and viral particles. I was very happy, and doing such programs, I appreciate a lot. Being a family student, you are initiating such initiations, and you're doing these activities are really appreciable, and I personally appreciate for such activities. And yes, it was the first session, I guess. Yes. So I was not groomed properly. Setup कुछ भी ready नहीं था, but still I think it was gone well.
Yes.
So
yes, it served the purpose.
Yes. In the next sessions, we'll try to be more effective. Yes,
sure. Thank you so much, sir, for accepting the invitation and coming here. Thank you so much. So we'll end the session. Thank you, sir.